do now is we really would like to welcome you to have conversations with us. There's lots of different services, stands, different parts of what we've talked about today around the room. There's plenty of tea and coffee at the end of the room, so help yourself, drink as much as you want. But please come and talk to us. These are your services. We're here to support you, so we want to hear from you, and we'd also like to answer any questions you've got. If you have a question and you're unsure as to who the best person to answer it is, just ask one of us and we'll direct you. There's also a board at the front that people can post questions on, post-its on the side if you want to leave a question there. Excuse me. Those questions will be uploaded to the questioning tool ahead of a streamed event on the Jersey Care model, which will take place on the 5th of May. We'll also upload any answers to any questions we get today on the gov.je Jersey Care Model website, so you can see what questions other people have asked. But please do spend some time with us and have a chat, and we'd love to meet you. And thank you for coming. We love doing this. It's really lovely to see you all. Thank you, everyone.
So, I'm here to talk about partnership working. And I think it's fair to say that for those of you that do know, Silkworth has had quite a turbulent relationship over the last 20 years that we have been involved with health. But I think it's important for me to highlight, I've only got a short time to do this, so there's 3 areas I want to talk about: the history, partnership, and the opportunity. The reason why I think I'm quite well placed to talk about that is because we've had the good with regards to relationships, we've had okay, and we've had what I would call now transparency and moving forward. I do have a slide, but I'm actually going by the slide, as you probably gathered. But what I'm talking about will cover all of this. So, like I said, the band, I think we over the years, we've built and evolved a relationship which has been based on trust, transparency, and most recently over the last, I would say, 5 years, proper partnership. So when we come to partnership working, it's really important for our organisation to be involved right from the outset. And I can honestly say with the Jersey Care model, I was sceptical at the beginning, me and my organisation were, because what did that mean for us? Where was that going to leave us? Were we going to find ourselves in a more vulnerable position like we have been in the past? But I can say that being involved with the planning, being involved with the discussions about what it's going to involve and how other organisations like ours within the island could potentially benefit was key to us feeling that comfort right at the very beginning. So that's a little bit about the history. The partnership since this model has started has been nothing but transparent. We've been involved as others from the beginning. We've spoken about where the hurdles potentially come in, and also we spoke about the opportunity. And I think sometimes we focus too much on the negative, when actually if we look at what potentially can be available for us moving forward, we can gather some hope from that. And Silkworth absolutely has gathered hope from that. So the opportunities currently are very much, it's open for many of us now. Not just Silkworth, but many of us. We can see, other areas that we can evolve, because let's face it, there are, particularly within health, there are things that are done within health that may be better placed in the community, and are most likely better placed in the community. This is our opportunity to be able to do that, and we have never had this opportunity before. We have got an aging population. We have got a greater need for our services, whatever they may be right now within the community. So, how do we facilitate that? From what I've learned from the care model, this is how we do it. This is the best way for us to do it. And by doing it in a transparent way with voluntary sector, private sector, and health, that is going to place us in a good position for ultimately the public of Jersey getting the best services within the community. Thank you.
So when we did the road shows, and I recognise many of you from the road shows a few years ago that we did when we launched the Jersey Care model, at every parish that we spoke at, people asked us about how we're going to manage the workforce challenge. I mean, it's no secret that globally, health and social care and care staff is a challenge for all organisations in terms of recruiting and retaining people with the right talent and the right calibre. And that affects us too in Jersey. So we knew that was a big thing that was very close to people's heart. Last year we started some work again across the whole island in terms of health and care partners about how we're actually going to start to address this challenge. And I have to say, COVID did stymie us a little bit as to how we went about this. But we had a really lively session towards the end of last year with our partners, which brought out a lot of passion, a lot of challenge, a lot of strong feelings about some of the difficulties people have attracting workforce and retaining workforce on the island today. Excuse me. And then we came up as a group with some high-level principles, some high-level objectives about how we're going to start to tackle the problem together. Now, as we said at the roadshows, we've already been doing work in this regard for a number of years, and I can stand here as the Chief Nurse and say very confidently we've been training nurses on this island for a number of years. We've got 54 students in training at the moment, but we are expanding those programmes. We've also got new programmes that have come online in radiology. We've also got apprenticeship schemes running, which are new. And we've also got other programmes in the pipeline that we'll be bringing online, which is around expanding the workforce that we have across some of our community providers. But there's other opportunities that we can harness as well through working together and working differently. Some of the other things that we talked about that really is close to everybody's heart who lives in Jersey is around accommodation and where people are going to live. And there's a piece of work across government that's well supported at the moment, which is looking at key worker accommodation at the moment. So that work is underway. So a bit like Jason, I'm not talking to the slides, but other areas that we're looking at are around terms and conditions, and again, not just in government, but across services, what our leadership capability is like. And we all know what it's like to work for really good leaders. It makes a huge difference to your careers and to your life if you have a good leader. So we have to make sure that we invest and develop good leaders across our services, and that people have meaningful opportunities for good careers here, so they're not waiting for dead man's shoes, for want of that phrase. And the biggest thing that we really want to do is involve islanders in recruitment. And we do that in some areas, but we don't do it across the board. So we do it for our student nurse programmes, and I've got colleagues in the audience who've been involved in that previously, and that has real value, having a service user involved in recruiting staff. So those are some of the examples of some of the things that we've done. So we came up with some high-level principles. We also came up with some key objectives, and those are the objectives that are going to start to take the shape of the framework in terms of, well, what does it look like, where's the milestones, and how will we know when we've achieved it. Our next phase, which was really well promoted at the Partnership Forum that James talked about, was attended by loads of people, was to get people involved and to say, well, come and be part of this piece of work with us. Let's work together and let's see what we can do to support each other around our workforce challenges. So that's the bit that we're up to. Next time we come out on the roadshows, I'll hopefully have even more good news for you about what we've done. So that's where we're up to. But come and have a chat with me on the stand if you want to talk about workforce challenges, or you've got some thoughts as to how we might do things differently. I'd love to hear from you. So I will hand over now to Claire.
Hello everyone, good afternoon. My name is Claire Thompson and I'm the Interim Director of Community Services. I'm just going to talk to you a little bit about our plans for 22. Some of these have already been alluded to by some of our partners and some of my colleagues. And as you would expect, a lot of these have been driven by patient feedback and also from feedback from our healthcare professionals, from our doctors, nurses and social workers working in adult and mental health services. So the 2 around teleguidance and telecare. So as you'll know, that we have an existing offer on Jersey that allows people to stay longer in their own homes and obviously have that support that they need. So if they have a fall, they know that help is there. So these 2 bullet points are really about promoting people's independence and being able to stay in their own homes and have independent living for longer. When I moved to Jersey and I attended some of the parish events around the Jersey care model, that was one of the pieces of data that I took home, the real sort of disproportionate benchmark that we have, because we don't necessarily have the offer around other care, other providers that allow people to stay in their own home, and so as a consequence of that, we know that a lot of islanders, a lot of our elderly, frail islanders don't have that variety of offer. It means about having a place at residential or a nursing home, where actually with a lot of these things that are on this slide developed and implemented, we are able to give people more options to stay in their own homes for longer. Particularly around the teleguidance, obviously what we'll see that evolve to also with using the telecare system is that we can build in bespoke measures that allow us to know if someone's long-term condition is deteriorating. If your dad, who may have had a stroke, who's normally cared for by your mum, and she wants a day off, and you want to know that dad's got up to move around, that the heating in his home is okay, or that he's got up to make a cup of tea, and so you know he's drinking enough. The new system that's been implemented will allow us to have that framework in place and know that people are safe. Interesting to hear the case model described by Claire, but particularly around our discharge support team, so that we know that when people are ready and safe to leave hospital, unfortunately we don't have the capacity either in our domiciliary market to allow people to leave hospital as soon as possible. And for any of you who have ever been cared for in hospital, and as comfortable and as better as we want to make you, most people want to get back to their own home as soon as possible, but they often need maybe a little bit more support than they did when they first came into us, because they're still getting over whatever made them poorly. So by having this discharge support team, which is a pilot in place till the end of the year, that's allowed us to do that, which of course has been fundamental as a hospital as we've responded to COVID. The care and reablement team, and also our rapid access frailty team. These are concepts that are in place in many healthcare jurisdictions internationally, and particularly with the frailty team, instead of just a sort of a one-offer around certain professionals, we'll be able to now evolve this and ensure that actually if you need to come into hospital, of course you'll come into hospital, but actually if it's about having a bit more physio in your own home, or for example having access to an occupational therapist, at the moment the only offer is perhaps admission to hospital to know that you're safe, but through this HES 24/7 and developing our frailty team that will be led by a geriatrician that we'll employ this year, we'll have a much better offer, a more comprehensive offer, which is not just about admission to hospital. And I'm going to hand over to Fiona, I can't see her there we are, who I know will be able to bring in her real awareness of obviously families that her organisation has helped.
Well, what a lot I've learned in this room today. I knew a little bit about the Jersey care model, but what's going on in Jersey at the moment is phenomenal. I just have one recommendation, I'm not sure who for, to do with the Jersey care model. I just think we should change the name. So I hope that's not a big problem. But I think it should be the Jersey Care for the Community model, because it is for the community. So I work for Brighter Futures charity, and we work with 170 families a week on average. Before COVID, it was about 150 families a week. Families referred to Brighter Futures for a big variety of reasons, but at that time in their life, they need some extra help in their life, and that's what Brighter Futures was created for. So thinking that we have about 170 families a week, when you consider the number of children, extended family, we're working on average with about 500 people a week, roughly, in Brighter Futures. And this is for them. This is for our families. I've heard some very interesting little one-liners today. Can you hear me okay? I just realised I'm not very
Not really, no.
I've just got a very big, loud voice anyway. So yes, listening to this, one of the things Rose said that really resonated with me was about good leadership. So for me, I would be asking the states of Jersey for good leadership on this Jersey care model, because we really need it to be driven by those leaders, so that myself, who I am very confident, by the way, from listening today, I am definitely getting to 150, because I think that the services in Jersey, if this all comes to fruition, are going to be so good for the community. But I think it's got to be transparent. It's really important that my community at Bright Futures, my 500 adults and little people, that they know exactly what's available, they know how to access it, and that it's easily available. And it's transparent, so that was the word, Jason, that you used, and I think it's key. I also think the partnership working as a charity, I was blown away by the Jersey Charity Commissioner who mentioned, and I've mentioned it to a couple of people today, that at the end of 2021, there were 437 charities in Jersey at the end of 2021, and since then they've signed up another 11 charities. So you're touching 450 charities in Jersey, and that's incredibly hard. I'm very proud to be part of Brighter Futures team. I'm exceptionally proud, and also the work that we do. But we are an island 9/5, and we have to get a significant amount of funding for us to run any charity in Jersey. So it's very, very hard to get. I was interested in the commissioning. I have been biting some people's ears already about commissioning in Jersey and the increase in that. From my charity perspective, that's really important. But the partnership work, in that word partnership, it's a really buzzword. People talk about partnership working all the time. But who is the partnership working for? So I think, yes, it is charities, third sector, the states of Jersey, but it's the partnership with the community that is key. And I hope that this Jersey care model, which has started exceptionally well, the fact that everybody is here, that we have some of our families present here today as well, is wonderful, because we're all learning what's available for us to have a good quality of life moving forward. So, thank you.
I just want to give you a bit of an overview of how we manage this project before we go into the more interesting part of what has actually been delivered and the new services. So, in terms of what is the Jersey Care Model, you may remember the States Assembly agreed the Jersey Care Model in principle and a wider business case. That was at the end of 2021, and the actual program of work started at the beginning of, in 2022 and started in 2021. So over the last year, that was our first year of the program, and of course a program of that size needed to be set up properly. It's a 5-year program of work, which means over 5 years we are establishing new services, we are modernising services, we are improving services, and a key aim for that was particularly around working in partnership with providers across the health and social care system. So hence you're seeing a lot of partners and the government services here today. The aim is to provide and support person-centred care, a key aim of the Jersey Care Model, and to provide more and enable more preventative care, particularly in the community. So to enable all of us to stay as long as possible independently at home, and only to be in the hospital if actually necessary. So if possible, and if already ready, being able to go back home. So what is missing, that was investigated as part of the Jersey Care Model, and what services should be in place to make the journey for the patient as smooth as possible.
You are very quiet.
I'm really proud, sorry, so much better to the
Yeah.
microphone. Yeah, it's not
Kiss the microphone.
All right. In order to, such a program of 5 years work, to provide the right oversight, we had to establish a bit of a governance. So I'll just talk you quickly through it. It's not the most exciting, but I think it's really important. The Independent Oversight Board has been requested by a scrutiny amendment and has been put in place. You may have seen that the Independent Oversight Board is established and has already produced their first report. So you will see the information online on the website, on the scrutiny website. The board is there to basically oversee and review and scrutinise the delivery programme. Are we doing it properly? Are we delivering on time? Are we having set out the right things? And it's a massive help because it provides that independent challenge and support to the programme. And it provides the assurance to the Minister and the scrutiny panel whether things are going right or not and what should be done differently if necessary. In addition to that, we have established a clinical and professional advisory forum. So what that basically is, when you create new services, it's important you get clinical advice and you get professional health and social care professional advice and support into the design of services. So that's what this forum is about. You can see a number of details here. It provides a level of clinical scrutiny as well, but it also prioritises what are the areas, the pathways, we call them the clinical pathways, that are really important based on the needs of what we see and the feedback we get from patients that we should look at first to improve them. Just to give you a bit of a flavour of what this group looks like, you have a permanent membership. The group is chaired by the medical director, Patrick Armstrong, and then you have a 2-year membership with a number and a wide range of health and social care professionals, so we get a good mix across all services. The partners are coming from the community as well as from the government hospital services and mental health services. Before I hand over to James Lefevre, who's then looking at the how we actually provide the forum for all partners to come together, I just wanted to mention that a key part of the Jersey Care model is using user experience and feeding that into service design. So we have established a separate user experience panel which will become more active once the pathway, the actual design of services starts. For that one, rather than having one group which has a number of patients representing everyone, that group will make sure that in each service design, the relevant service users are engaged and feed into the design. So much more intense and focused work on using service user experience. I'll hand over to James Lefevre, who will give you an overview of the health and care.
One of the great strengths of Jersey, I think, is the sense of community that we still have managed to preserve, that there are people who want to be making contributions to support other islanders, people who've got experiences they want to share with us. And when the model was developed, it was recognised very, very soon that there was a really crucial piece of work around establishing an effective partnership with the charities, the community, the voluntary sector, those who are already out there in the field doing some really excellent work across a huge range of services. The notion being that by working together we can really be much more effective in delivering what is an ambitious agenda where we're looking to really make some changes and improvements to how services are delivered. So the group was established, it's independent of health, and I was invited to apply and I was appointed as chair. And what my task really is to get out there, meet the charities, the voluntary sectors, find out what providers and what people think is happening on the street, make connections both between the charities so that they can work together effectively and avoid duplication, because sometimes that can be an issue. But in particular, to make sure that government is listening to what the charities are saying, what they think they can do and what they would like to do, so that we can be absolutely effective in delivering all of those things. If you look at the next slide, I'll be able to show you. So when appointed, I was fortunate enough to meet with probably 70 to 80 people and spent time with them finding out what it was they were doing in that sector, what their aspirations were and where some of the frustrations might have been as well. And invite them to join the partnership group, which they have done It's evolving and growing. Just this morning I've had 2 more charities asking whether they could become involved. And so what we do is have a range right across, if you can read it, across almost every sector. If there are some of them listening, you can tell us after. We'll seek to involve them as well. When I met with the reps, there wasn't anybody who thought that we didn't need to change the services in some way or another. There was a great discussion about the degree of change that was required, how it might be affected, but no one really did believe that we could carry on just as we are. There are pressures that we know around an ageing workforce. There are pressures around things like dementia, and we are going to have to work differently and more collectively if, as an island, we're going to really provide the best things that we can as we grow older. I was struck with the census data the other week, where I think it was 29% increase in the number of 65-year-olds during the last 10 years. And I'm prepared to tell you I fit into that zone entirely. And I'm wondering, what will it be like in 20 years' time when, God willing, some of us are still 85, and who's going to be there supporting us? So it's a real dilemma, but it's a real opportunity. So what these individuals do, they come together and we meet quarterly. It's quite a big bash when we get together, so we learn a bit more about the model, and then we do some work together in groups to see what might be taken forward in the next phase. So we meet quarterly, formally, and then discussions between the groups and individuals between times, and involving people in some of the work streams you've heard mentioned, pathway developments, and so there'll be a real opportunity for charities to be involved in making their contribution to make sure that we get it right, because it's important that this is done together. So I think that's all that I'm going to say, but if there's anyone who feels they haven't been involved and isn't included within the list there, we're more than happy to enrol anyone else who'd like to join us. Anushka.
Because Claire and family nursing and home care will go through them in a bit more detail. But as you can see, is particularly around the focus around the community, so overnight community care. A new service was there established with family nursing and home care already in April 21, which the aim is very much around during the night. If there's something that doesn't really require to go to the hospital, to the emergency department, can someone come out, a nurse, or actually as part of overnight care, a doctor, to look after you, and so you can stay at home. So Claire will have some great examples of what that looks in practice. HCS 24 is more or less a hotline for health and care professionals to have one-stop shop, more or less, for referrals, for advice, which at the moment wasn't always the case. It's something which is more in the background, but is particularly also for GPs quite frustrating. They have to call through a lot of different consultants. So having one-stop shop, one call centre to go to and get the right referral done is a brilliant thing. That call centre will be open for islanders during this year as well, so you will have the ability to get advice and guidance there as well, but more information will come out in due course. We have at home scheme. You may remember you have seen quite a lot of advertisement on buses, in the streets, encouraging islanders to apply for social posts in the care home sector. So we will give an overview what this has resulted in. It was very much around to strengthen the home care sector, where we know there's a huge demand, but the supply is always difficult to get. So that was a great learning, and a lot of training has gone into staff, and we also have been successful in recruiting new staff for the community home care sector. My amount is a completely different one. Digital is all over the place, of course, so how can we use digital to help us staying at home, managing maybe long-term conditions? So this is what this app is about, helping people to have long-term conditions, to manage them at home, whilst they are directly connected also to healthcare professionals. And therapies. So therapies, wide range of services, but very, very important what is being provided in the community. So if you have more questions about that, we also have an expert here today, which you can find at the Health and Community Services study later. If you would like to know more about what has been delivered last year, particularly on the Jersey Care Model Programme, I know there's a lot I didn't want to fill it all in today. On the website there's a full report, an annual report, which you can find if you just search for the Jersey Care.
For those who may not be aware, Family Nursing and Home Care is a charity that's been providing care in people's homes for over 100 years on the island. We are experts in community care, helping islanders to start well, live well and age well through our services, some of which are commissioned by the Government of Jersey. For example, health visiting, school nurses, children's community nursing and district nursing. Around 9 years ago, Family Nursing and Home Care developed a rapid response enablement team. This team's aim is to prevent hospital admission and support earlier discharge for people who can be safely cared for at home with the right level of treatment and support. This multidisciplinary team, which is commissioned by Health and Community Services, also supports people with reablement, meaning that they will receive a programme of support from occupational therapists and physiotherapists to help improve mobility and ability to manage safely at home. In the first quarter of 2022, over 1,000 hospital bed days were saved by the team providing multidisciplinary care in people's homes. Family Nursing and Home Care is proud to say that every service we deliver and its development is based upon the needs of islanders. A person-centred approach is key to all we do, whether that be in care planning directly with patients and clients and families, or using people's experiences to inform and shape how services run. We hope that the Jersey Care model will support the further extension and development of vital services we provide. A great example is the overnight nursing service. Until this started, we were only able to deliver nursing care in the community for adults until around 9 p.m. Anyone needing nursing care after this time would need to see the overnight doctor or attend the emergency department, and they'd often be await as emergencies are priority. Since the service begun, we've seen a steady increase in its use. Islanders who may be experiencing problems with medical devices or who need specialist medicines administered overnight, and patients who are reaching end of life who need symptomatic control, no longer have to wait or attend the hospital. In the first quarter of 2022, people put through to the overnight service were seen at home on average within 25 minutes. HCS 24 received calls overnight into hospital for the Jersey Doctors On Call service and Family Nursing and Home Care's overnight nursing service. Our nurses spend time with the staff in HCS 24 to help develop both services around the needs of islanders and the calls that they receive. HCS 24 help to keep our staff safe by checking in and logging the locations of staff. They also help with any follow-up arrangements. Tom is a 92-year-old care home resident. A call came in from the care home. Tom had experienced a fall whilst walking to the toilet overnight. He had some pain and some trouble walking back to bed. The care staff at the home were not sure whether Tom needed to go to hospital. Tom didn't want to go to hospital. The nurse visited straight away and carried out a thorough assessment. With their advanced skills, the nurse was able to competently assess that it was most likely a muscular strain. However, Tom would need an X-ray to rule out a fracture. With Tom, they decided that his pain could be managed with analgesia they had available at the home. The nurse arranged for an X-ray to be carried out in the morning and referred Tom to Family Nursing and Home Care's Rapid Response Reablement team. The care home arranged an ambulance to take Tom for his X-ray in the morning, and we were advised on what to do if Tom didn't settle. Tom did settle and slept until the morning. The X-ray confirmed there was no fracture, and Tom was seen back at home by the Rapid Response physiotherapist at 11:30.
So, to ensure that we continue to build on how we work together with our partners, a commissioning and partnership strategy was developed throughout 2021, and this included a number of partners. I think there was up to 40 people who participated in supporting this. Commissioning can be a confusing term for many, and for Jersey we believe it means the following: understanding and assessing the need of islanders, planning the services that will deliver for the needs of the islanders, actually delivering the right services, lastly, making sure the services delivered are of the right quality. And this will be done continuously through a commissioning cycle that you can see in front of you. And this breaks it down into manageable activities which are what we call strategic planning, which is really looking at the needs for the islanders, reviewing the services that we currently provide, and jointly deciding on the priorities that we need to go ahead with. We then look at the implementation and delivering, and this is designing the agreed services, shaping the structure of supply, planning capacity, and managing demand. And lastly, we will do that through monitoring and evaluation, which manages the performance and quality, ensuring that we support choice. And this will be a continuous cycle which is done continuously to make sure that we're coming back to the islanders to check if we are providing the right service and that we continue to develop, and where we need to improve, we continue to improve. And I will now hand over to Jake for a quick outline of the strategy.
So first off, I'm JP Hawkins and I work for the Commissioning and Partnerships team. So I'm just going to quickly run through the contents of the strategy. The first thing on the agenda there is the case for change. So that's essentially why are we doing this? And one reason is to create good commissioning that reduces working in silos. The next up is what commissioning is, which Washington just touched on, and explain how we worked with the commissioning cycle. After that, we have the commissioning intentions for Jersey, and we designed in partnership 5 intentions, and one of them was to support all people of ages to access the right care, the right place at the right time. It's not me. Just checking. The next one here we have is Jersey's commissioning principles. So these are the principles that we work to, and one of them being placing islanders at the centre of all our services. And then next we have the outcomes for success. What does success look like, and what does it mean for Jersey? And then lastly we have the delivery plan and governance, and what are we aiming to deliver, and by when, and the governance that supports that whole process as we move through the 3 commissioning models there. So that's it from me. We're going to hand over to Jason Weiss from Silver Charity. He's going to give us a brief talk about his experience of working in partnership.